Phil of York. We're going to be going through some questions today so that you can get to know me a little bit better. I always say that it's a little unfair that I got to ask all of the questions during a visit. Some patients ask some questions, and I'm always happy to share a little bit about myself. But for those of you that are interested, we'll go through some questions that my producers put together for me, just to get to know me a little bit better. Okay. So question number one. What do you enjoy about your work? That's a great question. I enjoy interacting with people. I'm in a unique job where I get to meet new people almost every day. There's a lot of people that don't get those types of interactions, and I get to meet people in a unique way as well, because it's not just superficial. I used to work in retail back before college. You meet tons of people every day, but you don't get to know anything about them. So I get to meet new people every day, and I get to know quite a bit about them and build a relationship with those people. And that to me is some of the most fun, when you get to see somebody come in, especially in spine surgery, where they have a problem, they've got pain, they've got an issue. You get to see them, talk with them about it, talk about their goals, and then it's always later down the road when they've recovered from a surgery and they're doing well and they're back doing things they want to do. Talk a lot about their activities, fishing, golfing, whatever it may be. It's fun to go through that process with the patient. So I think that's probably what I enjoy the most, is being a part of that for my patients, and being able to walk through those things, those parts of life with them. That's fun. So good question. What do you think defines a good outcome with various forms of treatment? I touched on it in that last question, but I think it depends. Everybody's got different goals. It could be that we have somebody that wants to be able to get on the ground and play with their children or their grandchildren, and they're having a hard time doing that because of pain. Or it's somebody who is a high-level athlete, whether it be around here, it's usually mountain biking, skiing, golf, and really any type of athletic activity that you can do in Colorado. Sometimes it's just being able to stand and do the dishes and be able to go on a walk with a loved one. Whatever the goal is, a good outcome really is defined by achieving that goal. And so it can be different for everybody, and we might choose a different surgical path based on what the goal is, given various pathologies. There's not always a one size fits all. You don't just get an MRI and know exactly what to do. It's an MRI, understand the pathology, understand what the goals are, and then do something to try to achieve that goal. And so a good outcome is being able to achieve those types of goals for the patients. Okay, let's go on to the next one. Why did you go into medicine? Man, go back into the deep recesses of my mind, back to when I was deciding that. It was my senior year of college. I was graduating with a degree in psychology. My plan was to go on to get a PhD in clinical psychology. I was on my way to do that, and it was my last semester when I realized that the day-to-day aspects of being a clinical psychologist was not very exciting to me. I enjoyed what I learned. I enjoyed using some of the skills that I'd learned in regular interactions, but the thought of doing that every day lost a little bit of its excitement for me. And I was working in the neuroscience lab. I was managing the neuroscience lab at my college, and I really enjoyed that aspect. We would do small procedures and do testing, and I enjoyed that very, very much. And so it was right around that time that I thought, man, I enjoy the neurosciences, I enjoy the procedural aspect. Maybe this is something that I could do the rest of my life, but it would have to be in medicine, become a surgeon, and then it was kind of a long process of getting back to medicine, going through getting my doctorate and becoming a doctor, and through that process deciding orthopedic surgery and spinal surgery. So it's a little bit of a long, drawn-out process, but it was definitely that final semester of my senior year of college where I decided that I wanted to go into medicine. All right. If you could change one thing industry-wide about treatment for spine-related conditions or pain, what would it be? Let's get into that. Well, I think we are in a very interesting time in medicine where there are a lot of competing interests, financial, insurance issues, different practice types, and different interests in various practice types, whether that be private equity and the overtake of a lot of medical practices by private equity groups, whether that be the growth of the insurance industry and the challenges that that has presented for surgeons, the government involvement in healthcare, Medicare, decreasing reimbursements. There's a lot of competing factors, and if I could change one thing, it would be for physicians to be able to go back to what they first enjoyed about taking care of patients and to not be influenced by these competing outside factors. I think for a physician to be able to see a patient and want to do the best thing for them, to do a good job, and never have a thought about why they're deciding to do that particular surgery, or whether or not this method of doing that surgery is going to be profitable enough for the hospital system, or whether or not the group supports making these types of decisions, or whether or not the insurance company is going to give you fits, or all of these things. I think if we could get back to the physician-patient relationship being the most important thing, where I get to spend the time with the patients, do the right thing, and never worry about those other factors, that's what I would change. And I think that, it's a good question, because I think that's what I'm trying to do. When I founded the Orchard Clinic this year, and have really spent much longer than this past year trying to put this together, the whole impetus for that was to get back to what I imagined being a physician would be, being able to see patients and do the right thing for them in a way that they appreciate the care that they get, and I enjoy the autonomy to be able to do what I think is best, not influenced by outside factors. So I'm excited about that aspect of creating this new pathway and getting back to that type of physician-patient interaction. I see too often these outside competing interests in medicine are now having a higher stake and have a bigger say in how decisions are made, and it affects the patient and it affects the physician-patient relationship, and I think that's a shame. And I think there's gonna be a lot of changes coming down the pipe in the next 5 to 10 years on how that happens. And I think as physicians, we really need to fight for the autonomy to treat our patients the way that we see fit, regardless of the financial aspect. And I think that that's going to be the direction that things are going in the near future. All right, deep one there. Okay, we'll do one more. Oh, tell us just a little bit about your family. Okay, sure. So I'm from Colorado, grew up in Littleton. I met my wife in high school at a small private high school that was in Littleton as well. We dated all the way through college in Santa Barbara at a school called Westmont College, and then married right after college. She was my world and my support through medical school. And then when we came back to Colorado after going to Oklahoma City for medical school for 4 years, we had our first daughter. She's almost 11 now, and went through residency, had another daughter a couple years later, and then finished my residency at the University of Colorado, went out to New York, the hospital for special surgery for my spine training. And then we were pregnant at the end of that and came back to Colorado and had my son. So it's been great to go through all of this and build a family, and it's exciting to see them now as we're well into my practice, and they love what I do. They love talking about interactions. They love coming to the hospital with me, and usually we get them some snacks at the hospital, and they love that. So I think it's fun to do what I do, but also try to have the family be a part of it as much as possible. So now my wife stays at home with the kids at least a couple days a week. We do a hybrid homeschooling and in-person schooling for them. So my wife is a total rock star and does a great job taking care of them during the week. And we just love being in Colorado. We have one dog. Her name's Pepper, and she's a Samoyed. And so we've got this great little family, and they are the loves of my life. And everything I do, I kind of do with them in mind, and to keep them happy and proud of me. And they love me well, and it's great. So, okay, I think that'll wrap it up for our first session of getting to know me. Hopefully you learned something about me, and we look forward to seeing you in the clinic soon.